Hi everyone, this is Dr. Demchenko, a chiropractic physician, neurologist, vertebrologist, doctor of osteopathy, sports medicine, and rehabilitation physician. And today we're going to talk about lower back pain associated with hyperlordosis and pelvic misalignment. How can you tell if your lower back pain is specifically caused by pelvic misalignment? Try to reproduce your pain first. If it is related to bending, for example, try to do it. Then we can modify it, that is, try to change it. To do that, you take your pelvis and rotate it back a little bit. While keeping this rotation, try bending over again. If you feel much better, our exercises will be of help to you. If the pain is related to, for example, walking, you can also keep the pelvis in a reclined position while walking. If the pain becomes noticeably smaller or goes away completely, that is also an indication for using of our exercise. Also, these exercises are good for people who have an unattractive visual effect in the form of a strongly bulging abdomen or protruding buttocks. How will we use the exercises to improve your pelvic tilt situation? The thing is that the position of the pelvis is determined by the muscles. Iliopsoas and quadriceps muscles pull the pelvis forward, so we are going to stretch them. The hamstrings, that is, the posterior surface of the thigh, and the abs pull the pelvis back, so we're going to strengthen them. The long extensors of the back also move the pelvis forward, so we'll be stretching them. Now let's move on to the exercises. First, lie on your back and make sure that your lower back is straight. To do this, put your hands on your pelvis and try to move it back and forth, feeling your lower back moving away from the floor and touching it. When you feel your lower back pressed against the floor, lock that position and keep your hands there. Next, we do an upward pelvic movement with a brief fixation at the top. Important point: when doing this exercise, try to pull your heels as close to your butt as possible in order to reduce tension on the posterior surface of the thigh and to engage the greater gluteal muscles and lumbar extensors more. Perform this exercise 20 times. If you are not strong enough, do until you are tired. For the next exercise, which aims to stretch the iliopsoas and quadriceps, take a deep lunge position. The front leg goes forward as far as possible and the body is level. Orient your pelvis so that it faces forward. Try to grab hold of the leg with the same side hand. An important point: do not bend it too much at the knee joint. Try to keep your body relatively upright and push your pelvis forward toward your front leg until you feel a distinctive stretch in the area where the iliopsoas muscle and anterior quadriceps attach. When you've reached a consistent feeling of tension, you can use post-isometric relaxation, a phenomenon that helps you relax your muscles quickly. To do this, push your knee into the floor and press your foot, the ankle area on the hand. The pressure should be light and steady for 5-7 seconds. After this pressure, exhale, relax, and try to move your pelvis a little more forward and down, taking a more extended position. Conduct 3 such sessions, or static stretching of the muscles, for at least 40 seconds. Next, switch legs and be sure to do all the same manipulation with the other leg. For the next exercise, again, assume position on your back. Legs are bent at the knees, hands are behind the head, fingers interlocked and secure the neck to avoid overextension in the cervical spine. Perform small curls incorporating abs without trying to reach your elbows to the knees. The lower back must be in constant contact with the floor. Do this exercise 20, 30 times or until you feel fatigue in your abs. For the next exercise, also lie on your back, grasp both legs and pull your knees up to your chest as much as possible, achieving a stretching sensation in the lumbar muscles. This is a dynamic exercise with a slight delay at the end of the range of motion. In order to stretch the muscles in the lower back area well. Since these exercises target the muscles, you can get a fairly quick effect on pain relief, but the pelvic tilt itself will take quite a long time to change. So we recommend doing these exercises for up to 90 days, 1, preferably 2 times a day. If these exercises have helped you, give us some likes, subscribe. This encourages us to make new videos. Bye, everyone!